Hey, this is Fred Claycorn with CompareMedigapCompanies.com, and today we'll be talking about Medicare Part D. And at the end, if you hang on, I'm going to give you a step-by-step instruction on how to enroll on the Medicare website, along with frequently asked questions. So definitely hang on to the end. This is also a part of a series. We'll be doing Medicare Part D, Part A, Part B, and Part C for all of those interested, and those will be done simultaneously week by week, so that'll be a 4-week series. So let's get started here. We're going to talk about when to enroll, how to enroll, and the cost and comparison tools. So first, what is Medicare Part D? Simply put, Medicare Part D is the Medicare Prescription Drug Plan, which is Part D, or is also known as PDP, Prescription Drug Plan, and it's offered for coverage that is for any Medicare participant. So there's definitely some different times eligibilities, which we'll get into, but in general, Medicare Part D is your RX or enroll in Part D. So there's two major times that we see this. The first is the initial enrollment period or open enrollment period. This is when someone turns 65. So 3 months prior to your 65th, 3 months after, you're in your enrollment period where you can elect Part D. So if you turn 65 in May 25th of any given year, May 1st is when your coverage is going to go into place. We're going to go into how to enroll in just a few slides, but this is when to enroll. So the other one that we see a lot of is a special enrollment period, which is an example would be, and again, the one we see a lot, when someone works for an employer and they have credible coverage and they decide not to leave work or retire at age 65. We see a lot of people now working into their 70s. But let's say you're 67 years old, you're now going to retire. You did not elect Part D when you were 65, and now you're retiring. That would qualify as long as you had credible coverage for a special enrollment period. There is many different special enrollment periods and eligibility periods. They're available on the Medicare website, www.medicare.gov. We're not going to go into all those. These two right here are the main ones that most people are concerned with. So where to enroll? So there's really two ways to enroll. One is through a local agent. So a local insurance agent can come out, they can talk to you. The one thing I would encourage you to do is always see an independent agent, someone who can offer a multitude of many plans. Unfortunately, we see out there that some brokers only offer 1 or 2 Part D plans, which is really a problem because there's no way that that plan is going to match your particular situation every time. So I would encourage you to always go to the Medicare website to run through the tool they have and they offer. It's a free tool. I'm going to show you how to use it here in the next slide, but it's very simple, very easy to use, and you can enroll right online. So you can use a broker, not saying all of them are bad. Make sure they're independent, make sure they can offer many different Part D plans and they're matching your prescriptions up with any given plan. So let's get into how to enroll on the Medicare website. So I would always recommend going to the Medicare.gov website. They have a great tool on here to search all of the available drug plans available in your particular zip code and county. So every year during the enrollment period from October 15th to December 7th, you can jump onto this site and simply click Find Health and Drug Plans. Again, this is www.medicare.gov. And once you click on there, it'll ask you for your zip code. You want to select your county, so in this case it's Charleston County, hit continue. And to avoid any kind of solicitations from insurance carriers or insurance agents, I would always recommend clicking Original Medicare. Leave all of these unchecked and then put I don't know. And then if you have prescriptions you'd like to add, you want to click yes. And once you do that, it's going to take you to a screen where you're going to enter your prescriptions in. So let's add a few just so you can see how this works. So metoprolol, you put in your milligrams or whatever it is you take, your dosage, how many times per day. So this is once per day. The frequency is once a month, so you fill it every month. I get this medicine from a retail store, or you can do mail order, which does change the price. It will give you both of these in the results, but you can check whichever one you do currently. So you want to add drug and dosage, and you'll see that it added it right down here. Okay. So we're going to add one more, just so we can show you how it works. Gabapentin. Let's say we take 3 a day. We fill it every month. We take 300 milligrams, and I get this from retail pharmacy. You're going to add drug and dosage. Again, you've got these both right here. My drug list is complete. Now the neat thing here, notice you've actually created a drug list ID, okay, and a password. So now every time you come in here, instead of having to re-enter it, you can actually just use your drug list ID and password. So this is going to work forever and ever. So next year when you come in here, you want to compare all the plans for 2021. Right now we'd be comparing 2020. All you have to do is put this in, and it will populate all the drugs you have. If there's any additional drugs or you need to remove any, you can do so. You can also select your pharmacy. So let's say I want to look everything within 3 miles. Okay, here's the ones available in my area. If I click Add Pharmacy, we have CVS and Costco. So let's compare those two. Continue to plan results. Okay, so here you want to check prescription drug plans only. There's 26 available in my county. You can see if you wanted a Medicare Advantage plan that has a drug plan attached, you could select this one. There's 19. In this case, we're just going to do drug plans, continue to plan results. And what I love about this tool is this is going to rank in order all the drug plans available in your county, your particular area, and it's going to rank them by out of pocket. So what it costs for the whole year to be in that plan. So the top plans in Vision RX PDP, you can actually enroll right there. So again, this is the way we would always recommend you do it, simply because you can avoid talking to a rep. You can also do all the work right here yourself very easily. And there's all these other items here that you can click on that'll give you a lot more detail. We're going to have another video specifically on that. But for now, this will give you enough information to at least go in there and run your prescription drug plan to make sure you're on the most affordable one. Again, we recommend doing this every year because they do change. Premiums go up, premiums change. So each and every enrollment period, you should go through this process. It takes about 15 minutes, and it could save you a boatload of money. We understand Medicare in general can be very confusing, let alone Part D. So here's some of the questions we normally see when we're talking about Part D and when we're visiting with our clients. Can I change plans once I elect a plan? The answer is yes. However, they are contracts, so they're annual contracts. They can be changed once a year. So there are some situations where you can change during any given year, but typically the enrollment period is October 15th to December 7th of every year. That's the annual enrollment period, AEP. During that period, you can elect to change your Part D coverage, your prescription coverage. I would recommend doing it the way that I just showed you on the Medicare website. If you elect a new plan during that period, it will become effective January 1st of the following year. So if it's 2019 and I elect a plan in enrollment, to change a plan that is, then it's going to become effective January 1st of 2020. Second question is, what if I currently have RX coverage? That's an important question, especially when you're in your initial enrollment period, because if you do have other coverage such as the VA or maybe through your employer, you really want to check with that HR department or with the VA in the example I gave to make sure that there's not a conflict and they're not going to mess each other up. A lot of times all you need is one prescription plan, not multiple. When can I change? Again, we just went over that, but this would be during your annual enrollment period. Again, October 15th through December 7th. What is the cost? The cost changes per plan. Not only does it change per plan, but different pharmacies cost different amounts. So that's why it gives you the option of comparing pharmacies. I showed you CVS and Costco, but you can compare any any particular pharmacies in your area. There's also a difference when you're talking about mail order versus retail. So definitely look at all those options, make sure you're getting the best pricing. We're more than happy to help you if you need our help, and I'll give you our contact information on the next page. Can the price go up? The answer is absolutely yes. The price will go up annually. There is certain rare instances where I do see decreases, but again, it's rare. So this is insurance, like any other insurance. Although it is Medicare Part D, it is through private carriers. The price will absolutely go up. That's why we encourage you every year to make sure you're doing the comparison and changing plans if necessary. There are no health questions on these. You're guaranteed to be accepted every single time. Are all of your drugs covered? Another great question. This is also something that you can see on that same comparison on Medicare.gov. It will tell you if all the drugs are covered. Some of them might have quantity limits. Some might have step therapy, which we can talk about in a few moments. But that question will be answered on the report that you run. Again, if you need our assistance, we're more than happy to help. Step therapy, as I mentioned a second ago, step therapy means that some companies, especially when there's a drug that's very costly, will make you actually try a different prescription, a different similar drug that's less expensive first before they will cover the drug that you want to be covered. Okay, so for example, let's say there's an expensive arthritis medication that you have to have. It might be covered under the plan. However, if there's a step therapy beside it, okay, and it'll show you on the report if that drug requires step therapy, they will require you try this other drug first before they will approve the more expensive one. Quantity limits, okay, quantity limits would be typically for narcotic. That means simply that you can only fill it once a month. So you might only be able to get 30 in any given month, and then each month you have to fill it. So you couldn't get that prescription for a 3-month fill. So no big deal, but quantity limits do exist on most narcotics and controlled substances. So what does prior authorization mean? So these are the 3 things you might see beside any given prescription on the report. Prior authorization simply means that your doctor has to call in and approve that drug. Once they do that for a given year, you're good to go for the rest of the year, but they will not cover it until there's authorization on that prescription. Thank you for joining us today. I really appreciate your time. I hope some of the content was valuable, and we look forward to seeing you on some of our additional videos that will be coming out shortly. Please contact us if we can help you in any way. Our website address is right at the top of the screen, along with our contact number. Have a wonderful day.